And welcome back. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And in our studio this morning, we're going to discuss an interesting innovation that may be of interest to many people who have a smartphone. So our guest in the studio is Dr. Kenneth Hill, and he is the co-founder of a company called Mina. How are you today, Dr. Hill?
I'm doing well. How are you?
Very well. You're a practicing physician, but actually you're also an entrepreneur, an innovator, someone who's developed a very interesting app called the Mina app, or of MinaHealth.com. Tell me more about this app.
Yeah, so my wife and I are physicians, and many moons ago we sat around the table and were discussing some of the inefficiencies in our practice. And one of the inefficiencies stemmed from whenever a consumer would come to visit us in our practice, and they would show up on time, but the paperwork was not done. And then over the next 20 to 45 minutes, they would be spending in the waiting room filling out this paperwork, and we figured that there had to be some improvement to the status quo. So the personal health record is that self-reported information that you report to all providers, whether it's a chiropractor, a dentist, a specialty physician, or a primary care physician. And it's standard information that all providers know. It's past medical history, past surgical history, allergies, medications. That's standard information, but it hasn't been standardized. So we standardized it onto a smartphone application. We standardized the responses to that questionnaire, and then we condensed the responses into a QR code, which is that square black and white haze that you can scan on all posters. And then on the provider side, instead of filling out those paper forms, they just scan your smartphone and then they get that information. And that information can be integrated into their normal workflow. So we take a process that's 20 to 45 minutes and transfer it to about 15 seconds.
Okay, it seems to make a lot of sense. What about privacy issues?
Yes, so we have created a number of security measures within the application itself. This information is the patient reported information. So this is your information that you're going to provide to the provider. We as a company do not have access to that information. The smartphone app itself has internal firewalls to prevent it from being shared with, other apps for location or shopping or anything like that. The app, it has a dual passcode protection, so that if you use your same security pin for your smartphone as you do for the Mina app, then you have a secondary security question that you must pass to get into that information. And then if you enter that security question incorrectly 10 times, it actually wipes the information. The QR code itself is our own proprietary licensed reader software, and it's part of our IP, how we encrypted that information. So if you had your phone on a table with a QR code and somebody else had a QR scanner, they won't be able to get that information as well. So we've taken painstaking steps to make sure that that secure information is you and who you want to share it with.
And how old has this app been? When did you first develop it?
So we established our company in 2015. The actual first version of the application came out in 2016, and we've been modifying it. We now have 4 sites up and going in the state of Georgia that are our beta test site, and now we're actually working next month, or actually this month, on 2 APIs with open source EMR. One's in a third world or developing country, and one's here in nationally in the United States, to actually take that information, and one of the ways to integrate it into the workflow is to actually auto-populate it into the data fields within the EMR.
And what has the reception been so far?
So the consumer is like, why didn't we think of this before? I'm a physician, and I know that providers are a little bit hesitant to change, but this is a 21st century to a 21st solution to a 20th century problem. And the providers that are using it do enjoy it, and they like the concept. We are an untethered personal health record. We are not an EMR system. But being untethered, then we can work with everybody. This is the process that all providers are doing now anyway. We just have a new and unique way of communicating that information.
So if you're untethered, are there challenges to that as well, since there is a standardization or an effort to standardize the EMRs.
Correct. So there is some challenges to integration of the information. So I would love to partner with all EMR systems to integrate the information, but this is standard responses that all EMR systems are requesting anyway. Now, on the provider side, from our reader software, we can just present that data to them, and by partnering with them, they can take that data and put it into the respective fields within their EMR system.
Okay. Is there any other message that you're leaving with attendees at this conference that are just getting to know MINA?
So MINA has a lot of benefits that is really difficult to explain in a short period of time, but one thing that is most important that I like individuals to know is that MINA is important for everybody that breathes air. Whether you are in sub-Saharan Africa or if you're in a developed nation, you have a health history. Our smartphone application is free. After you download the application, you do not need Wi-Fi or minutes in order to use the full version of it. And actually, we are able to incorporate in the technology and an ability to translate. So the standard responses currently can translate to and from Spanish. So we have an entire Spanish version of the smartphone application that the information will come to the provider in English. We plan on doing 50 languages in 5 years and kind of spanning the globe and becoming the new standard for communication of your health history.
All right, Dr. Hill, thank you so much for stopping by.
Thank you very much for having me.
I appreciate the opportunity.
Thank you.
And I'm Mabel Jong. We have much more to come. Stay with us.